Good day, my name is Gina Amaro from BSN1 section Abdallah. So today I'm going to perform the physical assessment, which is the IPPA. First step, remove all bracelets, necklaces, or earrings that can interfere with the physical assessment. Second, arrange for a well-lit, warm, and private room. Next, ensure that all necessary equipment is ready for use and within reach. For example, the stethoscope. Before preparing for the procedure, we need to wash our hands. So we need to perform the aseptic hand washing to avoid the transfer of microorganisms and pathogens. Next step is we're going to introduce ourselves to the patients. My ma'am, good morning. My name is Gina Amaro, your nurse attendant for today that's going to conduct the physical assessment. This includes the inspection, palpation, percussion, and lastly the auscultation. Next, explain what you plan to do and how long will it take. Ma'am, I'm going to perform the inspection, palpation, percussion, and auscultation as part of your physical assessment. This will only take for just 10 minutes, and we're going to find all the physical assessment that might find some abnormalities and also will help us determine the diagnosis. After that, perform the techniques in physical examination. First is the inspection. First is explain the process as you perform the inspection. Ma'am, for the inspection, I'm going to examine your eye, your skin color, the shape of your pupils, the shape of your face, and your body alignment, and also your smell. Next, expose each area to examine to good light. You may use pen light during examination. Skin to look for bruising, cuts, moles, or lumps. Face and eyes to see if they're even and normal. Neck, veins to see if they're bulging, distended, swollen. Chest and abdomen, stomach area to see if there are any masses or bulges. Next, we're going to the legs to see if there are any swelling. To the muscles to check for good muscle tone. And elbows and joints to check for swelling, inflammation, if any deformities are present. Next is we're going to perform the palpation. Position the client comfortably and encourage him or her to relax. We encourage the client to breathe regularly and slowly and not to hold his or her breath. Ask the client any tender areas before you start. Palpate those areas last. Avoid applying prolonged pressure in one area. Use the most sensitive parts of the hands and fingers to palpate specific characteristics. Proceed gradually from light to deep palpation. Take precautions when palpating lymph nodes and chest wall. After performing the palpation, proceed to the percussion. Position client comfortably and encourage him or her to relax. Encourage the client to breathe regularly. Percuss tender areas gently. Stop if the client is uncomfortable. Evaluate sounds produced in relation to location of underlying structure in the chest wall. So after performing the percussion in the chest wall, proceed to the back of the patient using the indirect fist percussion. To thoroughly determine if there are any abnormalities. So after performing the percussion, next is perform the auscultation. First, use drapes and adjust room temperature. Next is warm diaphragm or bell stethoscope in your hand before placing it on the client's skin. Listen to sound over bare skins. Perform the auscultation in a quiet room. Concentrate on the sound you want to hear and tune out other sound. For example, the heart. The heart produces a lub-dub sound. Next is auscultating the lungs. Anywhere on your back or the posterior or on in the front of your chest wall or anterior. You may encourage the client to breathe, inhale or exhale in order to determine any abnormalities in her lungs. So after the lungs, next is check the neck to listen for a swishing sound in the arteries. After performing all the steps in physical assessment, thank the patient with the physical assessment concluded. Ma'am, thank you for participating in this physical assessment. Lastly, document assessment findings in the appropriate section of the patient's record. So you're going to record your findings in performing the inspection, palpation, and the percussion and auscultation. So after performing physical assessment, you need to perform the hand washing to avoid the spread of microorganisms and pathogens.